Let's talk about colorectal care in the digital age. As a Gen X elder millennial, technology is both very useful and exciting, but also often confusing. However, one reason I'm grateful for it is because of the way that I get to take care of patients that are not physically in my office. Number one, telemedicine. Even though most of my patients I generally need to examine, there are some patients that I just need to talk through their problem and I can help them virtually through telehealth. So for example, if patients need colorectal cancer screening, I don't necessarily need to examine them. I just talk to them about their history to find out if they're at increased risk or if they're having symptoms, if there's something before the colonoscopy I need to know about so that I'm prepared when I go in there if I'm going to need to take biopsies or if I'm expecting to see a lot of polyps. That's something we can just talk about via telehealth, and most of my patients will take their appointments on their lunch break or they'll close their office door, and so they don't have to commute to come to an appointment. Anytime somebody gets a CAT scan or has blood work done, I can just go over that via telehealth and I can make sure that I have enough time to answer their questions. Okay, number two, online information. As a physician, this is both a blessing and a curse because I love for my patients to be informed, but there is so much misinformation out there, and even search engines that do their best to give the best information, sometimes patients get a little bit confused what applies to them and what does not apply to them. And while social media is wrought with misinformation, there are several platforms and lots of very smart people on these platforms that will give you the truth and give you the real information. There's also websites like the ASCRS, the American Society of Colon and Rectal Surgeons, that has clinical practice guidelines for other physicians as well as patient resources. There's the American Cancer Society at cancer.org, and then the Colorectal Cancer Alliance, ccalliance.org. That's an amazing place for patients to get good resources regarding colorectal cancer. Okay, number three, education, webinars, and virtual second opinions. There are lots of doctors that have groups on social media platforms where they talk about one specific disease process or one specific organ that people are having problems with, and they provide a lot of education on those platforms. So for example, they may do live videos, they may do webinars for the people that are in their groups. These are really excellent for patients that may not have that resource in their community or in their town, so they can get a lot of information about their disease process by joining these groups that are led by experts that can talk to them about their symptoms for educational purposes. Virtual second opinions. So there are multiple companies that provide virtual second opinions. One of these is my company that I created called Scope Consultations. This platform is good for somebody who's really kind of been to a bunch of different doctors. They've gotten a lot of different opinions. Nothing really seems to be working. They're kind of fed up, or they just kind of really don't understand. And they want time to sit down with an expert to talk about their problem, to just gain some empowerment and knowledge around what they've had done and what might be going on with them. I'm so grateful, but this platform has been a game changer for patients who live far away from cities where there are experts. They want confirmation of their diagnosis. So maybe they have already spoken to somebody and they just want to get a second opinion from somebody who has dealt with these diseases before, and they want to know if they're on the right track. Somebody who wants to make sure that they are clear of all their different treatment options. And then others that are just seeking an expert opinion. It's through platforms like Scope Consultants where people don't have to fly across the country to get an expert opinion. And for that, I'm grateful for technology. You can visit the website at www.secondscope.com. That's the number 2, ndscope.com. If you fill out the form, you'll get a quick survey that talks a little bit about your symptoms, so I know what you're dealing with. Then we'll get you set up with our HIPAA-compliant portal where you can send any and all protected health information that you want, and then we will set up a time to talk. You will not be rushed. You will get your questions answered, and I will also give you ways that you can advocate for yourself when you are at the doctor's office. Secondscope.com, come check us out.